So I have some practical experience, but also, of course, would like to share with you some theoretical knowledge about the cooperation and its value. So if we talk about multidisciplinary, about collaboration, we need to differentiate multidisciplinary team and interdisciplinary team, where multidisciplinary means that each professional operates within their specific scope and interacts only formally. Whereas interdisciplinary team, it's more, the communication is also not only formal, but also informal. So interdisciplinary team goes deeper and is now something we are focused on. According to World Health Organization, a collaborative practice needs to have healthcare workers who are prepared, of course, and who has learned how to work in interprofessional team. So it needs special education. So what we need to do is to start to teach students collaborate during their lectures in universities, so that they know how to behave, how to collaborate later on working. Interprofessional, according to definition of World Health Organization, interprofessional healthcare teams understand how to optimize their skills of their members, share case management, and provide better health services to patients and the community. So this finally results in strengthened health system and enables to improve health outcomes. So we have a greater goal here. So the first step is interprofessional education. Yes, so that we enable to produce good workers who are ready to practice in interdisciplinary teams. Yes, so this is the first level. We need to start teaching students. That is needed. In our university, since in Poland, in Poznań, since 5 or more years, we have interdisciplinary subjects where we teach students from different faculties, nurses, doctors, pharmacists, together. So they have seminars or labs where they have cases, and they needed to discuss the cases, and they work in teams already at this level in university. So then when they go to work, they are ready to discuss. Yes. And then when we have these workers, yes, the workforce, it is needed, then of course we can speak about collaborative practice to optimize health services. Of course, we can start, and we should start now, even if we don't have yet collaborative practice ready health workforce, still we need to start at the level of work too, because someone needs to be prepared. We need to make environment to do so. So now it is it can be difficult, but always beginnings are more difficult. But we need to work so that a future generation has some rules and it's easier for them and better. Yes, because we need to start. We do in Poland now both at the same time. So we teach students, and in our university, on scientific level, practical level, we collaborate with doctors, nurses to work on some procedures. So it is difficult period, but of course it needs to we need to start. Of course, it also needs the law, the pharmaceutical, the law in the country need to be adjusted to enable this collaborative practice. And what happened now in Poland, we have new law where pharmacies may do more. They may prescribe drugs, but it's all, of course, ongoing. It is the process now, on the process. Because there are countries like US, England, France, in West Europe, where they have more experience. In Netherlands, I cooperate with Netherlands also in Erasmus Sophia Children's Hospital, and there they have organized this, and on the level that I was there last time in 2014, so I think it's changed also there, but more they were writing to each other. But now we go into the point that we try to face-to-face discuss, because probably it brings, according to the literature, better results when we discuss. So every country, of course, has its own regulations, but the main goal is to work on interprofessional collaboration, of course, because it has many advantages, and I will speak about this now. And of course, to educate students, we need to work also at the universities level. Yes, so we need to know. We need to have lecturers, of course, and we need staff training. We need institutional support. So, of course, to organize these lectures, we need to have good learning methods, of course, especially methods which needs contextual learning and discussion. So, of course, we also need to have logistics scheduling. So it's many people need to work on this to make it possible, and to so that it's the best we can do. Of course, at the level of practice, also we need to have the same. But what is important, and what we have observed in Poland, the main things which are lacking now are structures, protocols. In Poland, we have this issue, but I think it can be every country, because, for example, we, according to our law, we now can. We are responsible even for medicine's review. So we review all the drugs patients are taking in hospital pharmacies. But what is lacking are protocols for cooperation. And this is the point, the weak point in our experience. It is, according to World Health Organization, it is needed. Yes, because everyone needs to know what they should do, when they should do, and what is the next step. So, example, we take patient to the hospital. Who is prescribing? What is the next step? Who is doing the review? So every step needs to be described in the protocol. So what is very important, we cannot say that nurses will do this, doctors will do this, pharmacists will do this, but they don't know how to really behave. Yes, so it needs to be really done that we have procedures in every hospital. And then it is fast, it is effective, and everyone is satisfied, because they know their responsibilities, what they need to do step by step. So this is what I can share with you. So we need to have shared decision-making processes. Yes, so protocols, processes, communication strategies. We need to build environment to discuss the problems in hospitals, in medical healthcare. So some, of course, management practices, personal policies. So everything need to be working well so that we have, of course, optimal health services. And according to the publications and the knowledge collaborative practice, what is the results? Very important. Can improve access to and coordination of health services, appropriate use of specialists, clinical resources, health outcomes for people with chronic disease, patient care and safety. But also what is important for us, healthcare workers' well-being. So people are, healthcare workers are satisfied with the job and they have better mental health, well-being. So everything goes better and can reduce, according to literature, rates of medical complications, errors, mortality rates, staff turnover, hospitalization periods for patients and medical professionals, communication misunderstanding. So it is of great value, and this is what we now need to do to work on this to improve. And I will. Yes, 2 minutes because I had some minutes left, so but I will go to the end soon. I would like to also share our work we have done in the international team in our during COVID pandemic. European Society of Oncology Pharmacy organized when Klaus Meyer is the chief, and organized a team. I worked in this. I had the pleasure, and we worked about impact of COVID pandemics on mental health, on oncology healthcare workers, and interdisciplinary collaboration. And what is good, the COVID pandemic pointed us to the conclusion that the interdisciplinary collaboration is very important because patients were lost during the pandemic, and it has improved. But on the other side, the mental health of healthcare workers decreased, and some even considered leaving the profession, what is not good. So as we know that good, well-organized interprofessional collaboration improves mental health being of healthcare workers, it is very important to really go into this direction, because we all have advantages from this benefit from this of patients, but also workers, yes, and this better environment to work in these teams. Okay, so also Pan American Health Organization considers that according to Pharmaceutical Service, they point that our goal is to right to the highest attainable, of course, standards, solidarity and equity in healthcare systems. And one of the one of the ways of achieve this if, of course, working in teams. And so from every side we can see that working in teams is our obligation, and we need to really focus on this because it has advantages, and to achieve many goals, this is the key point. Okay, so what does this is summary, some of summary. So what I said before, to improve the collaboration, we need to work on the education level first. It is very important. So we need to build interdisciplinary education where students need to interact, and we need to learn method adjusted to the evidence-based world practice, of course, problem-based learning and action learning sets. So students need to interact at the level of university. But of course, we need to have support for communication and dialogue of healthcare workers. So routines in team meetings, schedules, structured information systems, processes, effective communication strategies. So we need to learn this space. We need to have space and an environment which enable to eliminate barriers between different professionals. And of course, what I said, what I pointed before, clear regulation on assigned roles of different healthcare professionals, adequate human resources. We need to have people, workers to involve in the interdisciplinary teams, of course. So clear governance models, structured protocols, shared operating procedures. Of course, to offer adequate remuneration also, it is important. So, and here is literature I was used during my lecture. So thank you very much for your attention. Thank you.
Thank you. Thank you very much, Prof.